I think the average South Carolinian needs to be really afraid. I think they need to be calling their congressman and writing the White House and saying, bring the doctors to the table, get them involved, don't shut them out, have them involved in the process, because these are the people that I see for my health care. I want them to have a say-so about the health care that I get. I think people in the United States want to be seen soon, want to be taken care of quickly, want to be restored back to their health and back to their work and back to their families. And I think this is going to be totally different. I think patients don't understand that it's going to become a system much like what goes on in England and in Canada. And that's just not a system that patients understand. I don't think anybody who has ever been to England or has ever been to Canada and has had health care or talked to somebody that's from there says, boy, that's what I really want. I don't think that is going to happen. So there is going to be probably a creation of a different model for the American public that will change the way we all get health care and we all give health care. I think what will happen as we try to cover everybody, that we will end up with some kind of rationing. When Uncle Joe falls out of bed and breaks his hip, I think what we'll end up having to say to our patients' families is, we're really sorry about Uncle Joe, but he's 90 years old and we're not going to pay to have his hip fixed. I think when your kidneys go out, I think we'll dialyze you for 3 years, and then we'll say at age 70 or age 80, whatever age the federal government picks, in those 3 years, if you can't find a kidney, we're not going to dialyze you anymore. Now, if your family wants to pay for it, it's $200 a pop, it's 3 times a week. And I think you'll just see that we'll end up rationing health care in an effort to help bring down the cost. I worry about the mother who is single, has a couple of children, and is serving you at McDonald's or some other fast food restaurant, and doesn't make enough money every month to pay $800 or $1,000 of insurance premium. And she gets a breast lump and doesn't have any ways to see about it. And next thing you know, she's got a bad cancer, she ends up dying, we end up pouring a lot of money into her health care, and then we have 2 orphan children to take care of. Those are things that really concern me about where our health care is going. I think physicians need to be sure that we're at the table so that we're putting patients first in what needs to be done. The people in South Carolina need to be calling their congressman and saying, have you called Dr. Delaney? Have you talked to Dr. Jones? Have you visited anybody? Have you asked them what needs to be done? As far as I know, many of them have never been in the emergency room at 2 o'clock in the morning taking care of a gunshot wound. And many of them have never been in the operating room delivering a baby at 3 a.m. And they need to be asking physicians what is best and how do we provide that. I don't know that there's not any physician in this state and probably this nation that if his legislator called him and said, I need 5 minutes of your time, wouldn't be willing to sit and talk to him about some of the problems that he has with his patients.